Welcome to Spine Academy. In this video, we're going to provide an overview of the different cervical spine approaches. This is an excerpt from a broader course on cervical spine surgery in which we provide a high-level overview of the different types of surgery that are performed. If you're interested in seeing the full course, we've left a link in the description. When we think about surgical approaches to the cervical spine, there are really two principal approaches that we use as surgeons. One approach is from the front, or what we call anterior approaches, and one approach is from the back, or what we call posterior approaches. Before we get into the relevance of those approaches, let's talk first about cervical spine anatomy. If you look at the cervical spine in 3 dimensions, you have a structure that looks like this. Now, as this spine rolls around, you can see the different dimensions of the spine. Here you can see the back of the spine with the lateral mass, the lamina, the spinous processes here, the lamina and the lateral mass over here. You can see the nerves coming out of something called the neuroforamen on each side, and there's one on the right and one on the left. And then, of course, from the front, you can see the spine is made up of a stack of blocks. Between every 2 blocks is a disc, like here's a disc between 2 and 3 and a disc between 3 and 4. You can see there's some ligaments, like this is the anterior longitudinal ligament that all straps those together, and those are elastic structures that permit motion of the spine. So the spine is a very complex and beautiful structure that has ligaments and bones and discs and nerves and of course the spinal cord, and the relationship of all those is important to understand how we address pathology surgically. Now, if you looked at just the spine from the side in somebody with cervical arthritis or what we call spondylosis, it would look something like this. As the spine ages, people can develop arthritis involving the joints, and here you can see some of that, what we call facet arthropathy. You can see some of this gnarly stuff over here. They can develop some disc degeneration and bone spurs in the front or disc osteophyte complexes like you can see here. Sometimes people can develop disc herniations, they can have changes in alignment, and they can have ligament thickening, and some of those structures you can't really see on a 3-dimensional view like this. Now, if you took a slice through the spine like this, you'd get an image that looks like this. And in this image, we illustrate a disc herniation, where you can see, again, this is a slice of the spine like this. You can see the spinal cord over here. You can see a nerve on one side, a nerve on the other side. This is the front of the spine coming at it like this, the front of the spinal cord, and there's a disc in front of that. And here you can see there's this disc herniation pressing pretty hard on a nerve on this side. Behind the spinal cord, you can see there's some ligaments. The ligaments look pretty clean here. And pathology can be in the front of the spinal cord, front of the spinal nerves, and it can be behind it. It can be on both sides, one or both. It can be right in the middle. It can be off on the side. And where the pathology is important in determining how we're going to get there from a surgical standpoint, if that becomes relevant. Now, if you were to take a slice of the spine like this, what we call a sagittal section, you could see an image that looks like this. And again, this is illustrative. Here you can see this patient has some disc herniations, worst here between C4 and 5, a really large one at 5 and 6, 6, 7. Again, this is the front of the spine coming at it from the front. And you can see this is causing pressure on the spinal cord, which is a yellow stripe over here. The pressure is really significant at these 3 levels from the front. There can also be pathology from the back, like you can see this ligament thickening here pushing on the spinal cord from the back. So when we think of anterior and posterior, we think of it relative to the spinal cord and nerves. So we think structures from the front that are in front of the spinal cord and the spinal nerves, and structures that are in the back. On this image, again, structures in the front versus structures in the back. And that helps inform. It's one of the considerations when we choose how to manage people from a surgical standpoint. Now, if you look at that image, it doesn't show any of the structures around the spine. So instead, if you were to look at another image where you look at everything, not only the spine, but some of the structures around it, you get an image that looks like this. So here you can again see the spine. This is the same axial section that you can see over here without the disc herniation, but you also see some of the musculature. Here's the back of the spine, and these are muscles on one side and the other. You can also see the structures in the front of the spine. So this is the front, and these are big blood vessels over here. Here's something called the esophagus and the trachea. But you see some of the structures that are around the spine, and that is another consideration for when we choose and how we choose what approach we're going to use. So let's zoom in on this picture a little bit better. You can see there are some important structures in the back here. You see some of the para-vertebral musculature. All of this is muscle in section. And if you look in the front part of the spine, you can see some important structures. There's this one right here, which is an interesting one called the esophagus. The esophagus carries food from your mouth down into your stomach, and sometimes when we do surgeries from the front of the spine, people can have swallowing dysfunction, usually transiently, but sometimes permanently, related to how sensitive that structure can be. Right in front of that, you can see there's part of the trachea and the airway, and those structures are responsible, of course, for breathing and for phonation, or your voice box. Those are two really important structures that sit just in front of the spinal column, but there's some other important structures like these blood vessels that sit on either side, which are really critical structures as well for perfusion of the brain and other structures. Now, if you were to just look at approaches from the front, you'd get an exposure that looks like this. We don't go through these structures, but when we go in from the front, it usually gives us access to the discs, to some of the ligaments in the front, to the nerves on both sides, and importantly to the front part of the spinal cord. So surgeries from this approach we call anterior approaches. Anterior approaches are approaches from the front of the neck, or from here, that can target pathology that is anterior to or in front of the spinal cord and the spinal nerves. Now, if you zoom back out again and look at the whole spine and think, what is a posterior approach? Posterior approaches are approaches that you use to go from the back. This gives us exposure to the spinous process, the lamina, some of the ligament stuff here, the joints on either side, and the back part of the spinal cord, the back part of the spinal nerves. So posterior approaches are approaches from the back of the neck that can target pathology that is behind or posterior to the spinal cord and the spinal nerves. So in a nutshell, those two approaches, the anterior and the posterior approaches, are used to access pathology that's either in front or behind the spinal cord, respectively. Thank you for watching this video. I hope you found it informative. If you've enjoyed it, please like and subscribe. If you have any questions, comments, or ideas for future content, we'd welcome them in the comment section below.